Well, women have a 1 in 8 chance of developing breast cancer in the United States. October is the month to wear pink and raise awareness. I'm joined by Madison Ralston from the CHI Memorial Foundation and Brittany Hennessy from the Mary Ellen Locher Breast Center. Hello, ladies.
Hello. Good morning.
Good morning.
Thank you so much for being here. And of course, you all are wearing your pink. And one of the things we think about this year, this is the time of year that we raise awareness. And it's so important because 1 in 8 women, can develop breast cancer.
Yes, yes. And,
in their lifetime.
Yes, it's very important also, women tend to take care of themselves last, and this is just a time of year that we can stand out and say, hey, do this for yourself, do this for you and your family.
And we're talking about mammograms there.
Yes.
And there's always kind of confusion when it comes to mammograms. When should I get a mammogram? Should it be annual? Should it be every other year?
Right.
So clarify some of that for us.
We follow American College of Radiology guidelines, and they say age 35 for your baseline mammogram, and then starting at age 40, you would come annually.
Now, one of the things too they've talked about is that a lot of women, if you have dense breast tissue,
Yes.
Talk about that and how that could impact the results or maybe skew the results of your mammogram.
Yeah, so, breast tissue, dense breast tissue appears white on imaging. That's what we mean by dense breast tissue. And so cancer most of the time appears white as well. So it's kind of hard for the radiologist to sift through that tissue. So we recommend the 3D mammography, the tomography, and that'll allow the radiologist to kind of look at layers of breast tissue. So it's very important.
And I want to now turn to you, Madison, and talk about, and we have some pictures we can put up, a business that's partnering with you all, Suds.
Yes.
Tell us about that and what they're doing.
So Scenic Suds Car Wash is a great local partner. Mike and Griffin Moon, the owners, reached out last year to start just wanting to give back. Mike's mother and Griffin's grandmother passed away after her breast cancer battle, and they just wanted to give back, and how could they support? And so they are doing a percentage of their car washes all month to the Mary Ellen Locher Breast Center. Last year they raised $12,000. This year their goal is $20,000 for the 20th anniversary of the breast center being open here in Chattanooga.
And talk about the importance of a business like that giving back. And, I know we have some pictures there from the business, but how that means so much and when businesses take part and help to raise awareness.
So the biggest thing that we always strive to make sure everyone knows about CHI Memorial is all of your dollars that come to the foundation stay local. All of this money is channeled into our community for our local care. Patients can get exceptional, just top tier care right here in Chattanooga. You don't have to leave to go to Atlanta or Nashville or somewhere else for this incredible care that Brittany and her team provide. And partnering with our local businesses, particularly those who are putting their dollars right here in their community. Scenic Suds is locally owned. They grew up here. Mike's mother was treated at the Mary Ellen Locher Breast Center.
So he has that personal connection.
He does. And that just, kind of echoes the sentiment that Mary Ellen Locher had when she was going through treatment 20 years ago, that I'm here and a part of this community, and this care needs to be accessible for our community and our friends and family as well.
And before we run out of time, I just want to say that we're seeing more younger women developed and died breast cancer. I just had a good friend who lost her only daughter just a couple of weeks ago to stage 4 breast cancer. And so what is it, the reason that we're seeing younger women? And are you seeing that more in younger women of color, of just younger women?
I think it's generally younger women, and nobody can really put their finger on the why that is. Many women in their 30s now are developing breast cancer when usually it was somebody, later on in life developing. I would like to think it's because technology is getting better and we're finding it quicker. But you're also right. It is,
Yeah, just something. And when you think about that and think of, like I said, younger, because you would think for years it was always older ladies, and now you see someone in their early 40s or late 30s, and when they develop it, it's at an advanced stage. So again, the importance of getting that mammogram.
Absolutely.
Yes. Ladies, thank you so much, and for all that you all do in this community, and we know the great service from the Mary Ellen Locher Breast Center. So thank you so much for being here.